Hi, I'm Kristin Pelletier, founder of KP Consulting. One of the biggest challenges for every practice is keeping their patients active in the practice. An important part of keeping your patients active is to communicate the value in coming back for the next appointment. One of the ways of doing this is to ensure that your handoffs are done effectively with the patient in mind. Any time that information is passed from one team member to the next in front of the patient is a patient handoff. What I want to focus on for this tip is the handoff from the clinical team to the business team. An effective handoff from the clinical team to the business team has three main components: the what, why, and when. When you're communicating the what, you want to be sure to keep the information in patient terms, not clinical. For the why, you want to be sure to communicate the risk if left untreated, and the when communicates the urgency for getting treatment. So here's what I mean. A clinical team member passing a patient to the business team may just say, "This patient needs a DO on 14. That may be all the business team needs to take the next step. But it's not looking at the handoff from the patient perspective. Instead, I want you to communicate the what, why, and when in patient terms like this. Kristin has active decay on the upper left, and doctor is concerned if we let that go, it could get into the nerve and cause a toothache. We need to get her scheduled at our next available appointment so we can remove decay and prevent further problems." This does several things. Most importantly, it tells the patient that you're leaving her in good hands with someone who completely understands what's going on with her care. It also reinforces the message that the patient received from the clinical team about their condition. Studies show that it takes at least 3 times of hearing new information before a person really begins to understand and integrate it into their thinking. Lastly, it moves the patient toward the next step, which is making the next appointment. With all of the technology available today, I know that some of my clients have already communicated the clinical handoff to the business team through instant messaging. I recommend that they still do an orchestrated handoff, which is completely for the patient's benefit.